Radio show was previously recorded. The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha, and this is Be Fit for Health. I am your host, Bianca, and thank you for joining me on another beautiful day in Hawaii. And I just want to say I'm grateful again. I'm going to keep saying I'm grateful because there is no place else on this planet I'd rather be than in Hawaii because our weather is fantastic, number one. Number two, the people are beautiful here, kind hearts, just generous within themselves. And we're very blessed to be here on this beautiful day with my producer, Leah, and we're just ready to rock and roll and give you another great show. So today we're going to talk a little about something different. I know we've talked to many different types of doctors across the board this past year, and we're coming really close to my 1-year anniversary here at Salem Media. And I'm really grateful for that as well, because I really learned a lot this past year, and I hope you did too. And today is no exception. I'm bringing on a different type of practitioner, doctor. She is someone to be definitely respected, and definitely it's someone to listen to. She's an owner and founder of Allure Med Spa over in Waipahu and also in the Big Island. She has, I swear to God, accreditations. It's like a lot of abbreviations after her name. I don't think I've seen that many on any medical doctor, but Dr. Akau is one of those people who's got a lot of those letters behind her name: DNP, MSN, APRN, which I am swear to God I'm going to make her explain to me what all those are. Her objective really is in her career is really to help people find their beauty and really try to help as many people to find that beauty within, as well as in the external aesthetic way as well. Dr. Akau has a doctor, prepared advanced in practice registered nurse. She's a practitioner certified by the state of Hawaii with prescribing authority. Dr. Akau is board certified family nurse practitioner by ANCC. There's those letters again. American Nurse Credentialing Centers, trained by the world-renowned aesthetic medicine practitioners, and proud member of AAFE, American Academy of Facial Aesthetics. She's a postgraduate training and certifications to provide safe medical aesthetic treatments such as Botox and Dermal Fillers and treatments. So you guys are getting the gist of what else she does. Her nursing experience ranged from emergency room, acute intensive care experience, cardiology, medical surgical, geriatrics, pediatric health care, and medically fragile individuals. She holds a title of assistant professor and clinical facility, am I reading this right, in School of Nursing at the University of Hawaii Hilo campus, where she is directing and instructing registered nursing students and undergraduates at university levels. And she's also a faculty member of the Hawaii Pacific University School of Nursing, Chaminade University. My God, woman, you are very busy. Dr. Akau, are you there?
I'm still here.
Wow.
I'm here.
Wow. Can I just say, wow. What have you been doing? You're a young woman too. Like, how did you find the time to get all of this done?
You know what? I have a lot of support. My husband is very supportive. My family, my mother, my father, very supportive. So I'm blessed.
Yeah. Well, listen, we're blessed to have someone this smart. This is great. You're not just a pretty lady. You're also a very, very smart lady who has not only helped others, but you're paving it forward by teaching the next generation coming through the doors of the medical world. So bravo to you.
Thank you. Yes, we have our motto: we reach, teach, and inspire. And what good is our knowledge if we're not sharing it? So that's the legacy, I think, for me. It's been instilled by my mother, who is also a professor. And we want to train the future of healthcare. So,
what do they say? Sitting back and watching isn't going to change anything. You have to do it yourself. And you start with yourself, and then you by influence, you influence others to do the same. And that's basically my motto too. Like, I don't want to be a hypocrite. I'm not a doctor, so therefore I can't even fathom the level of understanding you have when it comes to certain things. But as a person who is dealing with certain conditions as well, I've become a student of life and I've learned a lot of things, and I'm also a personal trainer by trade. So, my background is in somewhat health and wellness, but I want to keep teaching too, because I feel like as I'm teaching, I'm learning as well.
Absolutely, right. Absolutely. And we want to be able to practice what we preach, right? So I think you're right on. And you don't need, to be honest, a medical or nursing degree anymore. Google is wonderful. I think a lot of our consumers are coming in, patients are coming in much more educated, and I love that.
Yeah.
It gets us on the same page. We are at the same level as far as prescribing and diagnosing. Patients know the symptoms when they come in, and so they're really the ones doing the homework for us.
Right.
We will base our diagnosis and our treatment based on their firsthand observation or experience. So I think consumers are much more smarter now. Patients are much more smarter, and I'm grateful for Google, actually.
Yeah, no kidding. As long as it's the right type of search engine. I always try to direct this audience to PubMed.gov if they can understand the technical terms on that site. But there is a lot to be said. Was it Med Web or something like that? WebMed or something like that. There's all these different types of. Yeah, exactly. Yeah. There's all sorts of different things that are out there that they can get as far as maybe some journals or publications that are written on particular topics. So if someone was to come to you, I'm sure there's a slew of information on PubMed.gov on Botox, right? For example, they could probably go on there and say Botox and, toxins, or Botox and, the response with diabetes or other types of illnesses. So that information that you were talking about is kind of great for us now because, before, 20 years ago, we really didn't know about these types of access. Only doctors had access to journals and publications, and now the public has it.
Absolutely. The website has, again, just so much information, but yes, you always want to make sure that the publications and articles are credentialed and backed. So PubMed is wonderful. I love using NIH. There's so many different information, avenues that you can take. I still look at books that are published because I'm, physical hands-on learner. I want to have it with me. But, online, there's the dermatology societies, there's American Board of, nurse practitioners. They all offer evidence-based research. And that's really what you want to make sure, that it's credentialed and backed by evidence-based research.
And for you being a teacher, you kind of have to be up to date with what you're teaching so your students are getting the latest and greatest when it comes to their practice. And I think that's probably, for me, that's what makes you stand out versus someone else in another med spa. I mean, you're not just a med spa. I mean, first of all, you had all these credentials and experiences. What made you go into the aesthetics of the healthcare industry?
Yeah, I love answering this question. As you can see, I have been in cardiology, and I enjoyed that with the provider that I worked with or moonlighted for. I've been in chronic illness and internal medicine, and I enjoyed it. But it was really, I think, at a certain time in my life with school and children, I was burnt out really quick. And these are areas of chronic illness management where, you really need to give your 110% to these patients. And I decided, I love education. I'm going to pursue education, but I want to do something fun. Yeah. And I, about 14 years ago, I worked with a plastic surgeon. I enjoyed doing aesthetics and injectables. And I said, I'm going to go back and I'm going to focus on my aesthetic practice. And now we have the autonomy as nurse practitioners here in the state of Hawaii to have the designation as a medical director. And thanks to House Bill, I want to say 658, that we went and testified, and so it got passed through the legislation about maybe 4 or 5 years ago. But we have been able to practice again autonomously. Now, I don't want to get anybody, misunderstood for a medical doctor. I still have those collaborations with MDs, internists, cardiologists, and I have really good friends because we still need that collaboration. I still need someone that I can talk to say, hey, I'm not sure about this. Can I get your opinion? And what do you think your treatment or regimen would be. So I just want to share a little bit about why I decided to go into aesthetics again. It's fun, it's rewarding, and a lot of the times I'm a people person. I love talking, and I would say in an hour's appointment, 45 minutes of that is really talking, getting to know my patient. I am not held by a certain quota by an organization, and nothing is wrong with Kaiser, and I love those places. But I have the autonomy to sit and talk to my patients, build a rapport, and figure out what treatment is needed, if any, and how I could help better their life or situation.
Yeah, I hear you have a reputation of really being practical when it comes to those who come in, because there are people who get addicted to the stuff. I mean, they get really addicted to the fillers and to the Botox to the point where it's a little too much. And you're one of those doctors that you're not there for the money. I mean, you're there to make a living, but you're not there to literally scourge the money out of people's pockets. You're trying to tell people, honestly, this isn't what you need. This is not where you need to go with your aesthetics. And for that, I respect that about you, doctor.
Yeah, I love that you said that. I would say no to 80% of the population that comes in, and 20% of them actually need something.
Yeah.
If my patients, I feel like they don't need Botox or fillers, or we're at a point where I think that's enough, I'm okay with saying, hey, you know what, I think we should revisit this conversation in a couple of months. But my goal, again, is to look natural. And a lot of the aesthetics, I think visually, people will look at you and ask, hey, what are you doing? Why do you look so natural? And I love that. Now, not all practitioners want that natural look, but, I do.
Those
and
chocho lips are really in.
Yeah. Yes. And I'm sorry, I don't have any chocho lips, but,
that's funny.
I just... Yeah, to each its own, but I definitely, your patients become a walking billboard for you.
Yeah.
And I never want a patient coming in saying, hey, you know what, I think this is just way too much. I don't look natural. I want to dissolve it. Let's get this out. Knock on wood, it's just the way I've practiced. Everybody has their, individualism at practicing. But for me, natural is always best. And, and less is more in the end.
Oh, yeah. And plus you save a lot of money too. I mean, seriously, it can get costly. But I wanted to ask you, because I'm sure people that are listening, they probably always had these questions, but never had the chance to talk to someone like you. So tell me exactly, how safe is Botox? What's in Botox? And what does it serve? What purpose does it serve?
You know what? I'm happy that you asked this question. It's the most common question that I'm asked in a consultation or in an aesthetic appointment. So I want to share a little bit about toxins. There are 4 different toxins here in the United States that are FDA approved. We've got Botox, made by Allergan. We've got Dysport, made by a company named Galderma. We've got Jeuveau, made by a company named Evolus. And then we've got our last one, which is a natural type of toxin, which is called Xeomin. And for me, our practice, we only carry 3 of the 4. I will share a little bit about toxins. It is a muscle relaxer, and we like to say that. It inhibits the muscle movement or that connection from the actual receptor transmitter transmitting that response to the brain. Okay. It inhibits it. It is temporary. So the good thing is it only lasts for 3 to 6 months. The bad thing is it only lasts for 3 to 6 months.
Yeah, exactly.
Yes. So you're gonna have to, if you love the appearance of it and the effects of it, if it's therapeutic, you may not. It's not something that's permanent. So having to redo it is a must. I will tell you there are some contraindications for all of the toxins, and some of the illnesses that we kind of deter from using Botox are multiple sclerosis, muscular dystrophy, Lambert-Eaton syndrome, a lot of these issues that affect muscle movement. And so, again, we don't want to put a product in them that's going to affect muscle tonicity or movement.
So how does that affect if you're putting it on the, let's say your forehead? Let's say somebody comes in, they just want it on their forehead, and the person has MS, but does it seep into their blood flow, and does it go to the rest of the body, or does it stay localized?
So the idea is that it's localized in the muscle, but we've got millions of blood vessels. And so to prevent it from entering any vessel, good luck with that.
Yeah.
I think that's the last. Yeah. So, we don't even cross that bridge. I know there are other providers. I think neurologists who are a little bit more trained in, generalized treatments, but I want you to know that these patients may have alternatives, and that's where Xeomin would come in. Xeomin is a little bit more of that pure product. It doesn't have bovine or cattle byproducts or even egg byproducts. And so there are some other products that may be, I guess, okay for these patients to take. But in my practice and in a lot of our practices, patients who fall under this category may not be a good candidate. And so we really would refer them to a neurologist. When I say neurologist, I think a lot of the patients that are coming in are having either issues with migraines, and they may have a history of multiple sclerosis or muscular dystrophy. That's a little above our scope of practice, and so I would send them to a neurologist and have that neurologist make that medical decision.
What about fibromyalgia? I'm asking personally because that's what I was diagnosed with.
That's perfect. We actually have seen therapeutic results, and again, it's not FDA approved, but there are some evidence-based research that shows it actually helps with myalgia or muscle pains and more specific facial nerve damage or facial nerve pain.
Wow. When
we've injected it in certain nerves in the face or in certain areas, it'll actually alleviate pain or myalgia in that pain.
I've never heard of that. It's awesome.
Fibromyalgia really is a generalized term of pain, and if you have it and you're struggling with it.
Yeah.
So being able to, identify what nerve is causing that pain is really difficult, because typically patients come in complaining of full body, head to toe,
right,
down to the fingertips.
Yeah.
And so, we wouldn't offer Botox as a treatment. There are other medications that help with generalized pain.
But if you're someone that has a neurological response, like a headache that may be caused through either hormonal or any reason, it can alleviate the headaches because it is pain afflicted, right? So that's why you guys put that.
Absolutely. Yes, absolutely. We have a lot of the patients coming in for migraines, and it depends on where it's starting, either in the temporal region, in the sternocleidomastoid, or in their trapezius muscles because of tension. And so there are specific areas as practitioners that we are trained to inject to alleviate the tension, to give them a therapeutic response, and so they're not able to tense up, and it prevents those migraines or headaches from, I guess, progressing to active migraine. So yes, there are specific points and usages for botulinum toxins in migraine and therapeutic type of treatment.
Very interesting. I'm like always been curious about how we've evolved to body beautification, because as a trainer, that's, body beautification through physical activity. But then when you're able to do things without surgical, intervention, and you're able to make somebody look younger through something as simple as injecting a muscle relaxant. That's just amazing to me. I know you guys do other fillers too, and I know people out there are aware of like Juvederm and Restylane, which I feel like is it's more my go-to possibly in the near future, because I am 50 years old. But it is something that, because it's hyaluronic acid, and hyaluronic acid is what our bodies make. This is what our bodies naturally are inclined to understand and recognize. So it won't be a foreign particle that you're putting into your system. Is that correct?
So you are correct in terms that it is. Well, no. You are absolutely. Hyaluronic acid is a natural product that our body typically makes, or it makes. As we get older, we start to deplete, which is why our skin becomes much more saggy and so forth. It's that same thing with collagen and collagen production. What makes hyaluronic acid in a filler form a little bit more difficult is that hyaluronic acid is an unstable molecule. There is a product that makes it stable in the production phase, and that is called, it's a bacteria, streptococci, and we all know that as strep.
Right, strep, yeah. You're putting strep in your body. It's awesome.
Right. Right.
I love it.
So it now becomes a pathogen, right, in your body. And so patients who we really contraindicated when we are doing a consultation for fillers are, do you have any type of autoimmune disease? Because naturally your body is going to try to fight that, right?
Correct.
It's a pathogen, it's a foreign object. And so, in our consultations, do you have any type of autoimmune disease? And that would lead to a contraindication. The other issue that we're dealing with is untrained, unskilled, or just, injectors in general, I think, not understanding that hyaluronic acid, when injected into a vessel, is an irritant. Right. And if you occlude or clog the vessel, it actually prevents blood flow and oxygen and nutrients to perfuse that area. So if I'm doing the lips and I injected the filler into a vessel, it'll occlude that vessel, allowing for that tissue to die. And I don't want to scare any of our patients, but I do want to educate. And this is where informed consent comes in.
Right.
The risk of occlusion is high with the numbers that we're now treating, because we're probably at 22 million injections in 2020 versus 8 million about 10 years ago. And that's because it's becoming much more popular.
Right.
So, of course, you're going to see those instances of cases like this rise. That's a given. The other issue is it can also cause blindness. And there are probably about 148 cases in the United States of blindness. There's probably more, but undocumented and unreported.
Yeah, but that's out of 20,000, right?
True.
Yeah.
Right. But it happens if we inadvertently inject filler into a blood vessel.
Right.
It travels up towards the retina, and it causes blindness. And so, understanding that the level of your practitioner, their education is very important.
Yeah.
And who you choose to inject your face. So, a lot of people will go for the best deal. And like you shared, it's not about the money. It's really about them feeling happy and healthy and looking beautiful. At the end of the day, this is a medical procedure and there are risks. And so ask your provider and practitioner, what are the risks? What are the complications? And what is your plan to reverse or to fix?
Yeah.
If something happens or something goes wrong.
Yeah,
should have a plan B.
There's always going to be a risk with anything that you put unnaturally into your system, first of all, and injecting it or however we implement it into a body that's enclosed, you're opening something up to expose it to a possible infection or what have you. But, this is why I wanted you on, because out of the respect that I have for the type of person you are and with the field that you're in, you're very particular in the way that you are addressing your clientele. And I like that because that tells me that you're educated, you know what you're doing, and that you have an understanding of what products you're using and why you're using it. So I guess because you have a slew of services that you're doing at your clinic, at your spa. And I'm very interested because some of the things I don't really see in too many medical spas, like you're doing, and I'm just going to give you a few and then we can talk about it, is vacuum therapy, which is with cellulite and body shaping. The other one is vascular therapy, which is very interesting to me because mostly you go to vein clinics to do the deeper vascular issues because of conditions that may be arising from that, whether it's cardiovascular or thrombosis or things like that. But what you do is a little bit more superficial, correct, with the vascular therapy?
Yes, exactly. So, getting back to sclerotherapy, those are typically, we use a sclerosing agent that dissolves, or we inject it into spider veins, and it dissolves it, and, very superficial. I do have a provider, again, that I used to moonlight for, and I'm going to do a little shout-out, Dr. Canetti. He's out in Waipahu, Hawaii Vein Center, that I worked with and worked under, that does a little bit more of the deep vein thrombosis post-care, and also what was that? All of a sudden I'm losing a blank.
That's okay. It happens.
I thought of Dr. Canetti. He popped up in my head, and I just thought, what a education as far as him. So, yes. So I do, as far as the cardiovascular side, spider veins can be an indicator again, and I shared that with you. And varicose veins, that's what it is. Varicose veins and ablations, actually.
Yeah.
They can be signs of bigger issues such as cardiovascular disease. And so making sure that you're seeing your primary care provider and following up on those varicose veins are very important. But yeah, we don't do some of those bigger ones. We'll refer you. We've got a great referral system.
Yeah.
And ours
and that's
is a
important
little bit
too,
more
right?
aesthetic.
Because you're
It's just
partnered up
visual.
with doctors that can take care of the bigger stuff that you as a doctor of nursing has that medical background. You understand the human body well enough to recognize something that maybe a patient may not have even thought about. And maybe looking at it as you're treating the spider veins, you're seeing something a bit more, dangerous. So you're like, okay, look, I can treat this, but I think you should probably go to this doctor because this may be a condition that I can't treat you. I'm not that doctor. So that's important, but not too many other med spas have that kind of care. And I think that's really huge that you have, like I said, you're a young person. I don't know where you found the time to do all this extra knowledge, but amazing that you do have that. But going from there to, I wanted to say, you also do tattoo removing. So you're using now lasers in your clinic as well, correct?
Correct. We've got an arsenal of lasers that we tend to use, all different brands, all different purposes, and lasers actually it's been around for a really long time, but they can do some of the bigger treatments where chemical peels couldn't, as far as discoloration or actinic linting Gs that we try to take off. I think the sunspots. It's just a quicker response. You get a instant result, and I think a lot of patients are heading towards laser usage instead of more topical type of treatments. I do want to say though a little bit about lasers and who would be contraindicated, since we're talking about that.
Yeah.
We have a big Asian population, and a lot of providers may know that there are certain lasers that are specific to different skin types. They're the Fitzpatrick scale 1 through 6, and that basically says you're from light skin, blue eyes, blonde hair, all the way up to darker skin, or like I said, African American.
Right.
Well, here in Hawaii, we've got a big Asian population,
Right.
and we understand that Asians actually, because I myself is Asian, we respond very different to heat and heat lasers, which means it can cause something called PIH, or post-inflammatory hyperpigmentation, which, if our patients are coming in to get rid of sunspots and I introduce a certain type of heat to their skin, I'm actually going to make it worse.
Right.
And so, your practitioner understanding that different skin types will act differently, or what lasers are a better option for these patients, are very important, because you're either going to like the treatment or you're absolutely going to hate it. But the provider practitioner should understand your skin enough to be able to treat you appropriately with the different types of lasers.
Yeah, it's kind of interesting because as I was doing a little bit of homework on laser treatments, I know that laser is used for a lot of medical, operations, like, whether it's for, your heart, or if it's for general tumor removal, things like that, because it's less blood, less cutting. It's much more quicker. But it is radiation, but it's not the level of radiation that you would get if you're doing like a CAT scan or MRI. So I find laser treatments of any type very interesting to me, because I think throughout the decades, I think it's been 2 decades or so, it's really advanced quite a bit. But I do remember the machine, the fraction, what's it called? The fractal machine?
Yep.
Yeah.
Fractional laser.
Yeah.
Mm-hmm.
So that's something that was used for, I think, laser hair removal back in LA when I was there. And I remember it being very uncomfortable. But you guys use it for many different things, like resurfacing of the skin. And what else can you use that for?
Yep. So resurfacing of the skin, it helps with the appearance of fine lines and wrinkles, stretch marks. You can really use CO2 for a whole bunch of things. It can cause a controlled wounds to help with burns and scars.
Wow.
So it's multifaceted. CO2 actually now is being used in the vaginal rejuvenation
Wow.
type of treatment where, and so
tightening of the
it's
skin?
still being tightening of the skin and the vaginal or female part area to tighten that area. So,
Okay.
As far as science and advancement in technology, it's just amazing. And CO2, it's a pretty aggressive laser. It is causing a controlled burn with CO2.
Ooh.
And it really is, as far as wound care and caring for it, preventing infection, it's a big thing, but I've seen the best results with CO2. So,
Is that better
fractional
than the
laser.
fractional laser, or is the CO2 laser more preferred by you?
So CO2 fractional laser is the laser itself.
Okay.
It's a CO2 fractional laser. It gives off a fraction of and I want to go back to the ionizing or non-ionizing radiation that you were talking about.
Right.
And you're right, it is non-ionizing, which, on a safety level scale for cancer or your radiation index as far as you being exposed is very low. A lot of the lasers that we have, again, we do have safety precautions and procedures for our staff. We put them through training, and, our doors are all marked for laser and preparedness, making sure they've got the right eyewear and so forth. But again, the laser and the non-ionizing radiation that it emits is such a small or minute part that, again, there are no studies showing that it can increase the chance of cancer. However, we do want to make sure you're still using your protective eyewear because it can, cause damage to your eyes and so forth. So, a lot of the times we have patients coming in doing lasers and they'll ask, and I'm just putting it out there, they'll ask if their children can come in the room. And I'm always like, absolutely not. It's not safe. If they take off those protective eyewear that we give or provide, it could cause retinal damage to their eyes.
Yeah.
So I think, if you're thinking of doing any type of lasers, if you can have your children, or even pets, stay outside or at home, that's the best approach to any type of treatment.
Well, any light has
The
a wavelength
non-ionized-
that can go through your eyes because your eyes
Yes.
are open, right, to receiving the light. So if you're putting light laser, it's a light. It's a specific piercing light.
Right.
You're going to get it in your eye faster than anything else. Yeah.
Absolutely. And that's the light that really causes the damage. Thank you for clarifying that. It is.
Yeah.
It's the light that it's emitting. So, I think getting back to, our goals and sharing the services that we offer, the goal again, Bianca, is having that holistic approach. And I do want to share that we have another branch. It's called Allure Derm and Wellness Center, and we actually have primary care practitioners that are
Nice.
working with us that have patients that are chronic illness, and some, again, internalists that's working with us that we can refer to. But again, it's really that holistic approach. So mind, body, and soul, we want to make sure that the patient is, happy and healthy, not just in our presence, but at home. And I think if you look good, you feel good for the aesthetic side, and that's where our aesthetic side for Allure Laser Med Spa comes in. But if we can educate and we can teach along the way, that's our goal. And all of our practitioners in our clinic is willing to sit and talk and educate.
Do you do any type of educated forum, like a YouTube? Do you guys have like a YouTube channel where or maybe this might be something new you can start if you don't, but so that what you just did here on the show, I'm pretty sure people would tune in and ask you a bunch of questions that would probably help with educating the public in a different perspective. Like you're educating the professionals, but people like us out here in the real world where we're not quite clear about certain things. Like you've got Kybella, which is a treatment that you do, which is also injectable to help with your chinny chin chin. to get that nice in tone.
Yes.
But, these are things that people may know they've heard, but they don't understand what it is. So they may not even come to you because they don't even know if that's going to benefit them. So, I think something like this is needed. I don't see it out there. I mean, I think this might be something that might be in your future. I think might be a good idea if you guys don't have that already.
Yeah, so, again, education is key, and I actually have a YouTube channel.
Good.
It's Dr. Lehuanani Akau. I have 78,000 followers.
Wow.
And I'm actually trying to create a little studio in my home so that I can do more educating on the patient side. And as you mentioned, I educate our nurses and providers that's out there, but I think the general public want to know what's going on and how to best approach certain issues and topics when it comes to aesthetics. So you can follow me on my YouTube channel.
Nice.
I have one. It's Dr. Lehuanani Akau. And another way that I also educate, and this is more for providers, is I have an organization. It's called Hawaii Medical Aesthetics Academy, and we try to hold quarterly trainings for MDs and DOs and nurse practitioners, also registered nurses, to learn about aesthetics. And my biggest thing is anatomy and the safety of our community. So training these providers to be safe injectors and accountable at the end. So.
Yeah, that's kind of huge. I think that's wonderful. Yeah, definitely follow. Yeah, follow Dr. Akau. That's amazing. I'm glad. See, great minds think alike. But my question to you is, do you have any type of specials going on right now in your spa? I mean, that people can maybe take advantage of that may be interested in some of the things that we talked about today?
Yeah, so I know you touched up a little bit about Kybella. We've got a great special because summer is here, and we all want to, or summer is approaching us. We're in spring, and we all want to look our best and feel our best. Our Kybella specials right now, they're 25% off original price. We've always got specials on lips and Botox. I want to share a little bit about Kybella because a lot of people don't know. It's new on the market. Kybella is made by Allergan, and they were just geniuses in patenting the acid. So I'll share a little bit about it. It's deoxycholic acid.
Okay.
It's a natural acid or derivative of our gallbladder. So we naturally make fat dissolvers.
Okay.
We can use that to inject it in areas such as the submandibular area or that double chin, and it's FDA approved to be placed there, or in our jaws. And it'll dissolve fat. And in about 6 weeks, that fat has been reduced from about 60 to 80% after one treatment. And so it's highly effective. Yes, highly effective. The chances of you having a reaction to it is very rare because we all have gallbladders unless they were removed. And really your lymphatic system drains the area and you push it out in your waist as far as getting rid of that fat.
Does it have any neurological response or no?
As far as neurological, if it's injected in areas such as the submandibular nerve, which is near your face or your jaw, obviously, it can irritate it. So there is some side effects, and that's one of the side effects is paralysis of that nerve, and it's temporary, and some of the research shows that it can last from up to 2 days all the way up to 260 days.
Oh, wow.
So with any procedure, like you've mentioned, there are risks and side effects. There are some techniques and procedures that I actually do to prevent us from hitting that nerve directly with a needle. And so we use cannulas and different types of tools to prevent injuring that nerve.
Wow. I mean, that sounds really interesting.
Yeah.
I mean, certain products that came out from our own natural, like the hyaluronic acid, and now I didn't even know this was something from the gallbladder derivative of that. But that's really interesting because to me, I've heard of this product, but if you have loose skin but not a fatty chin, does that work as well with loose skin? In the like, you know what they call it, the chicken thing? What's that? The little thing that flaps the bottom of your.
Right. Yeah. So it doesn't help with loose skin. It is really a lipolyzing type of product that destroys fat.
Okay.
But there are different treatments, and again, going back to lasers, radio frequency right now is gold standard as far as skin tightening.
Right.
And it's the only research-based type of product to show a big change in the skin elasticity. And so radio frequency, which we've got a wonderful machine. It's by Venus Concept. It's called the Venus Diamond Polar, and it's a skin tightening machine that triggers collagen to be produced in that third layer of skin, or the reticular dermal layer.
Got it.
And so it'll take a couple of treatments, anywhere from 3 to 6 treatments, but it'll tighten that area post-fat dissolving.
Wow, that's amazing. Guys, you have everything there. I'm going to have to check you guys out. Like I said, I'm at that age where I'm going to have to start looking at what options do I have. People look at me to think I'm insane, but it's like, look, man, I'm in the industry of health and wellness. You know, it's not just what you eat. It is important. Your nutrition is key and crucial because you need all those nutrients. But at the same time, sometimes Mother Nature needs a little help and a little boost to get you going, to look a little bit brighter and happier, so to speak. How can they reach you? Because we're coming on, and I promise to get you off because you've got some students to take care of. So how can people reach out to you? What's your website? What's your phone number? Where are you located?
Sure. So we are located in Waipahu in the West Commercial Plaza, 94216 Farrington Highway. We're on the second floor, right above Clinical Labs of Hawaii.
Okay.
Our phone number for our office is 808-200-0209. And again, if you want to hit us up via email, you can allurelasermed@gmail.com. And then, of course, our YouTube site, Dr. Lehuanani Akau. So follow us and subscribe.
And I'll probably have the links as well on my YouTube channel and my website, MP3. We have reoccurring shows. So if people want to kind of double back and take a look, I'll have that information on there for you and the people listening. So definitely appreciate you taking the time. I know you're a wanted woman with all your credentials. I can't imagine. Do you sleep? I'm just
a little
bit. Okay. Because you got a family too, right? That's another job in itself. So
right.
That's awesome. Well, thank you so much, Dr. Akau. You're a wonderful human being. I appreciate all you do for all your peoples, and continue educating those nurses and get them out there so that we can get the kind of care that we want. And I appreciate that very much from you.
Yeah, thank you so much, Bianca, and thank you for having me. This is a wonderful show, and look forward to talking to you again soon.
Absolutely. You'll be hearing from me. Mahalo.
Thank you. Mahalo.
Bye. Okay, everybody, we're going to take a quick break. We're going to listen to my commercial. And then when we come back, I'm going to kind of close up the topic here and give you guys some new information that, just a little bit of an announcement. And then we'll say goodbye from there. Okay, looking forward to hearing you back in 15 seconds.
You don't need to be a member of a gym to get your health and fitness back on track. Be Fit for You with a Be Fit for Health online personal training and nutrition program. With 30 years of personal training experience, Bianca will help you better yourself and be fit for health. For more information or to schedule a free wellness consultation, visit BeFit4Health.com for more.
Okay, we're back. So, we spoke with Dr. Lehua Akau from Allure Laser Med Spa, and she's over in Waipahu. And she also has, I believe, another clinic in the Big Island in Hilo. And so, her background being very clinical and very medical, it's very interesting that she took the route of doing aesthetics, which she said it's much more gratifying and fun. And she's very much of an artist too. She likes to look at people and make sure that she's giving them the best possible solution for what they're wanting. I mean, she's not a magician. She's not going to make you look 20 years younger unless you do plastic surgery. That's a different thing. But the benefits of it and then the contraindications are very important for you to know. I mean, look, it's great to look younger and get your confidence back that way. But, you also want to make sure that you speak with your medical doctor, even with something as simple as doing an injectable or laser treatment, because you don't know how your body's going to respond, right? someone like me, or any female over the age of 45, if you have hormone fluctuations, which I didn't talk to her about, it can affect your body's response to a treatment. You might not feel as good, especially if you're on your weekly cycle. So you want to make sure that you are aware of where you're at health-wise before you do anything that may be injected or introduced to your body. So, with that being said, I think, overall, it's a safe practice. I think most people, 90% or so are safe from getting things done. Less is more, as she said, because you can't take things out, but you can put more in. So it's always good to just kind of, be cautious, find the right practitioner, because, there's a lot of people out there that, look, and nothing to take away from regular medical doctors, but, if you're an eye doctor, you're not a skin specialist. I can see dermatologists doing this. I can see someone who understands the human body inside and out doing this. But, you got to be careful with the type of people you go and get treatments from. So always do your homework. That's just my ranting here and lecturing as usual. If you can do your homework, you most likely will get the results you want, right? So just to, go over some of the things that I wanted to go over today was that, it's been about a year. I would say in about a week or so, we're going to be hitting 1 year that I've been doing this show. And it's been such an honor for me, because the reason why I came on was I really felt this need to educate not only myself, but to the public, because in my field of expertise as a personal trainer for 30 years and as a manager of many facilities in this industry in California and here, I've seen a lot of clients, and not all of them were mine personally, but the public in general. I'm finding that there was a need for education when it came to certain ailments, and also where to go and what other options can you do besides the traditional Western medicine, medication, or procedures and surgeries, because not everybody wants to get cut up, or not everybody wants to take narcotics. And so I've been on a journey for the past 20 years with this. I've learned a great deal about myself, and I've learned a great deal that the options that are out there are out there. Something as simple as sleeping. I mean, people laugh when I say that. Oh, well, what's the big deal, Bianca? Everyone knows sleeping is good for you. Yeah, but you don't do it, and if you don't sleep well, your body doesn't get a chance to go into the healing factor, because we're always stressed. We're probably stressed out, 12 to 15 hours out of the day. And by the time you get to bed, it's like 11 or 12 at night, which is late. And your body is already at an exhausted, fatigue state. It's been dealing with environmental, mental, emotional stresses. So that sleep is crucial to giving your system a break. And these are the kinds of things that I wanted to educate and be a part of. And, the good news is that I'm going to continue doing this, but I may not be continue doing this with Salem Media, because I might be taking a break for a bit, just because of scheduling. And, I realized that I may not be able to get into the studio as often as I did, because of the changes in my lifestyle, my job that changed because of COVID, and starting a new job. Don't know what my schedule will be like. So I didn't want to cheat you guys from the value and the type of guest that I would be able to bring on. So what I am going to be doing, and I would love for all of you to go to my YouTube, really, because this is where I'm going to be doing some of my interviews, and this is where I'm going to be doing a lot of the education that I'm going to be coming up with. The YouTube is BEFIT, the number 4 health. It's the name of the show, Be Fit for Health. You could also reach my YouTube via my website. There is a lot of vlogs there. And, I think my last show for this year is going to be, I think, either next week or the week after. I'm not quite clear, but, I'm going to do the best I can to give you guys those last 2 hurrahs of good guests, and go over anything else that you guys may want me to go over. So here's a little bit of homework for you. Please reach out to me, whether you want to email me b.bfitforhealth@gmail.com. Ask me or tell me what type of a show you want. So that way I can do the best I can to get you that information. Or you can go to my website, Be Fit for Health, and go to the contact page and just fill out what you want me to talk about, what you want me to bring on as a show, because I think that will help me give you guys the type of show that you want me to finish up with. So that's one part of it. The other part is my YouTube is going to be less in length. It's not going to be an hour's worth of shows. It's probably going to be snippets of 5 to 10 minutes on topics that I'm coming across. And in the near future, I'm working on, I'm not a writer. God help me. I'm probably one of the worst writers in the world, but I'm going to attempt this. I'm going to try to write a book, and hopefully get it out there within the next year or two on pain management and being the lab rat from a viewpoint of fibromyalgia patient. So it's going to include all of these thoughts that we had this past year, and it's going to include some of the comments and guest points of view that from medical doctors, and my perspective and some of the things that I've accomplished. And pain doesn't necessarily have to be fibromyalgia. Pain can be anything. It can be from your spine. It can be from an injury. It can be anything. So, recovery is based on lifestyle choices. We talked about this last show. 80% of what happens to you is lifestyle choice. 20% is just luck of the draw. It could be, genetics. It can be, injury or what have you. But lifestyle choices, meaning sleep, food, exercise, environment, things like that. So I'm trying to put all this together for all of you so that we can come up with a really good game plan for all of us together. And what I say, we're greater in numbers. We get more done in numbers because you have more minds thinking for each other and things that you may think about that I may not have thought about. So again, I'm here for you guys. I want to make sure that I'm able to provide you with the best quality of service that I can. After 30 years of being in the health and wellness industry and being around a lot of medical doctors, I've probably seen in a matter of 20 years, maybe, 100 to 150 different types of doctors. And now with the show, having 50 some odd shows, I've got to speak with 50 some odd doctors and health practitioners. I mean, this is insane. You're not going to get this kind of a research done. I would say I've been a guinea pig and a lab rat for about 20 years and trying all sorts of different things. And so I have a slew of things that work and things that don't bother, man. Don't even go there. So, with that being said, thank you so much for listening to me today. And I just want to, emphasize that this might be the end of a show for now, but you won't lose me entirely because I will be in some form of social media. You can go to my IG, which is b.fitforhealth, or you can go to my Twitter page, Be Fit for Health. So there's all sorts of ways to get in touch with me, especially my website. My website will stay up and I will continue to service you guys as best as I can. So tune into next week's show. I look forward to hearing from you guys as far as some suggestions, and we're going to go from there. Until then, please take care of yourselves. Enjoy the rest of your day. Be healthy and be well. And I wish you guys aloha.